The situation in Gaza remains absolutely dire for children and their families. Yes, we have this pause in hostilities where we're able to bring in more aid supplies, and we have improved access to populations. But people, over 600,000 people have moved from South and Middle area to Gaza North and Gaza City, and what they're seeing is the absolute devastation and destruction of their homes and lives since the start of this war. So the fragility of this pause is very acute, and we saw that this weekend. But what we need is this sustained pause in hostilities to allow people to start to rebuild somehow their lives across Gaza.
Rachel, we're looking at pictures there of Gaza, which is basically rubble right now after 15 months of fighting. People are returning to try to pick up the pieces to continue with their lives. And of course, they're facing wintry conditions at the same time. What sort of aid is being provided to them?
Yeah, it's bitterly cold in Gaza. It's very much winter, and we've had rain over this weekend. And of course, there isn't access to clean water, to sanitation. So it's really a perfect storm for a public health crisis. We need all humanitarian aid, all life-saving essential supplies need to come into Gaza, which includes tents, which includes other shelter items, bedding kits, clothes for children, but also water, sanitation. Everything is needed, and of course food. People are still hungry in Gaza, and there isn't enough food or clean drinking water to sustain the population.
Gaza's main hospital was hit during the conflict. We saw footage and reports of medical staff having to make do with whatever supplies they had in the hospitals to operate on the injured. Has access to medical services improved since January 19 when the ceasefire was implemented?
Yeah, there's been a massive effort to start to rehabilitate some of the medical facilities in Gaza, which of course were absolutely devastated for the 15, 16 months of the war. Save the Children, along with other partners, have been able to bring in some medical supplies, running 2 health facilities, one in Deir al-Balah and one in Khan Yunis, and the demand for services, of course, is very much maintained. The population across the whole of Gaza still requires access to essential life-saving healthcare services.
Rachel, this ceasefire that's currently in place is very fragile, as we've seen earlier this week, and it can be broken at any time. Do you have a plan B, plan C? What happens if or when that ceasefire is broken? How do you operate in order to ensure that aid is still getting through to conflict areas?
Save the Children has been operating in Gaza throughout the war, and for decades before the war, we've been supporting children and communities in Gaza, and we are always prepared for different scenarios, but we are currently working through the current scenario where we have an increased access to communities and to children, and of course to humanitarian supplies. But in this war, which has been so devastating for children, and as you said, the fragility of this current pause and ceasefire, but we remain prepared to be able to adapt to whatever the scenarios become, whilst hopeful that this ceasefire lasts.